I showed you earlier an audiogram of a client I'd just seen in the clinic, and that particular client had moderate hearing loss in the higher frequencies. And what I've done on this little example here is just show you the right ear. And as I said in the previous video, what we're looking at with the audiogram, this is the audiogram, is we're looking at the frequencies along the horizontal axis from the lows through the mids to the highs, and down here we're looking at the level of the signal that the client requires in order to just hear, their thresholds of hearing. What I've now done is I've added on what we call the normal range for the normal population. So if you go in and have a hearing test, dead easy, as you know from the videos you've seen already, and your hearing levels fall within this shaded area here, the audiologist will conclude that your hearing is within normal limits. Basically, in this particular example, the air conduction thresholds beyond the very low frequency here at 250 Hz fall outside that range, and the conclusion is that there is a hearing loss. Now, one other thing to remember if you've never had your hearing tested is that this type of a test can be done by children from the age of 3 years. So there's nothing to worry about when you have your hearing tested. It's not hard, it's not difficult, it's not uncomfortable, it's quite good fun, you'll enjoy it. And what the result will show is how your hearing in your right ear, and then again on the other side in your left ear, compares with the normal population. We'll go on in the next video to look at the other test that we use in diagnostics, which is the bone conduction test, and how we then interpret where the problem lies if there is a hearing loss and what we do about it. Once the audiologist has completed the air conduction test using the headphones, we then move on to using the bone vibrator that fits behind the ear. And remember that the bone vibrator uses bone conduction so that it bypasses the outer ear and the middle ear and stimulates the inner ear directly. So if there's any difference between the air and the bone, or if they're the same but not normal, it's then possible for the audiologist to figure out what the problem is and what the best remedy is to a solution. Now, in this particular case, I'm just showing you the right ear for the air conduction, and as you can see, it's not bad in the lows and it drops away in the highs. This is the result for the bone conduction test, where the bone vibrator was placed on the head behind one of the ears, what's called the mastoid bone, and these are the results that we find. And pretty well based on what you can see here, these are overlapping. So the bone conduction overlaps for the air conduction. There's no difference between them. And as a result, the conclusion from that test would be that the loss is sensorineural. It's in the inner ear. Again, remember that this test uses pure tones and it compares the hearing of the client with the recognized norms in the normal population. So this particular client that we've seen this morning, in this example that I'm just showing you here, has a sensorineural hearing loss in the right ear. And if I just move that away, because normally that will go on the same chart, the actual thresholds for the left ear are also similar for bone and air, and as a result it's a bilateral sensorineural hearing loss that we're dealing with. Now, the solution to this particular problem is the fitting and use on a daily basis of modern digital hearing aids, and that will be the discussion that will ensue as a result of the audiological investigations.